First of all, I'd like to thank Ma'am Agnes of the DOLE for accepting our invitation, and for Andrea, one of our board of directors, for organizing this Zoom. No doubt, our industry is one of the most, if not the hardest hit sector because of this pandemic, no? And we are all feeling it, and sometimes even showing it in our faces. And, but they say loves company, so we are here together to share our miseries. Just kidding, you know. I think it's very timely that we have a session with the Department of Labor. There are many concerns, especially with our people, employing them for a few days, a month. How do we deal with this? What do we look forward, or what can we look forward in the next 6 months? What are the things that we need to also be aware of in terms of employer responsibilities? So on this note, we'd like to start this forum with Ma'am Agnes. I don't know, Ma'am, how you want it to be. You want it that you will give a speech or a message first, and then we'll do a open session wherein we ask our questions. But we give the floor to you, and we thank you for this time that you are giving us. Good afternoon, Ma'am.
Agnes has been with the Department of Labor for 38 years, no? Labor inspector and then head of the Antique Field Office in July to December 2012. Then she was assigned as head of the Technical Support Services Division sa DOLE Region 6 ng 2013 to 2016. Pagkatapos, for NIR sa July 2016 to 2017 and assigned as head of the Negros Occidental Field Office in May 2017 to the present. So, siya gid na subong ang head sang DOLE di sa Negros Occidental. So, Agnes, thank you very much for accepting the invitation. In instant na yan, basta may istra mo, hindi mo na maindian.
Good afternoon, everybody. So, even if we are in the pandemic, no, we still should be happy, no, that we are alive every day. So, amo na ang consolation manako, no, that every morning when I got up in the morning, masiling ko nga salamat nga I'm still here, no? I'm still around, you know. Actually, I have been trying to look for somebody nga makalink sa DOLE kag Hurano, si Attorney Andrea malanggali ang makalink, no? Because there are actually mga programs in the DOLE, mga advocacies, orientations, pero hindi gid namon ma-top gid ang organization, no, or ang grupo niyo. But now we're happy because may kabalo na ko kung sino itap. And then of course, we have industries, abi, no, like sa inyo, example, na dapat represented man in the tripartite industrial peace council, no, sa province. So good afternoon again, and I'm happy to be with you, no, this afternoon. But when I asked Attorney Andrea kung anong format naton, if we go with questions and answers, she said that it would also be best if I will discuss a little about the latest issuance, of course, of DOLE and DTI on the supplemental guidelines on the workplace prevention and control of COVID-19. Since this guideline speaks of strategies on prevention, detection, isolation, treatment, and recovery, no, in the workplace. So siling ko basi pwede man nga ma-share ko anay ini sa inyo. Kaya there are, of course, responsibilities on the part of the employers and the employees. This is supplemental guidelines, no, on the workplace prevention and control of COVID-19, issued by DOLE and DTI last August 19, 2020, no? This is part of the Joint Memorandum Circular 20-04A. And this is guidelines that will assist our private employers in developing the minimum health controls and standards now in the light of the pandemic. So it applies to all workplaces, whether micro, small, medium, or large. It also applies to all employers and workers in the private sector, okay? Correct na. So, okay, the guidelines actually, as I said, speak of prevention, how to prevent the spread of COVID, how to detect COVID in the workplace, that covers our employees and the visitors or our clients, how we can isolate our employees and our visitors, how to treat if there is symptomatic to the virus, and how to recover. So first, because of the pandemic, damo gid man sang problema, no, ang tanan nga industries. And in fact, our workers or employees are, they are really hoping nga matapos na yung pandemic. Everybody, I think, including the employers, are hoping nga matapos na yung pandemic because nag-apekto, no? It affects actually the family, the person, and so included in the guidelines is the request for employers to provide psychosocial support, no, sa tanan nga mga workforce, especially those showing mental and health concerns, no. In fact, may mga nagaginawa gani nga studies nga kadamo na sa mga may mga mental problems, no, kadamo sang may though hindi nakabalo kung what to do, no. So employers can help by referral system. Pwede sila ma-refer sa accredited mental health specialists such as the National Center for Mental Health Crisis, no. So ara da sa ang gina-flash man ang ilang hotline numbers. And of course, we also request our employers to continue promoting work-life balance, no, especially in this pandemic, no, in these very trying times, through proper scheduling of activities and workforce rotations. So ang DOLE, in fact, naka-issue ng Labor Advisory Number 17, dated May 16, 2020, wherein employers can adopt work from home or alternative work schemes or the flexible working arrangement. So sa work from home, pwede, kung may ubra, nga pwede maubra malang sa balay, that would be better than the worker going out the house, going to the office, may mga problema sa public transportation, no? So, however, in the work from home, importante ang support, no, mechanism. Kaya siyempre, if you work at home, so you need a laptop, you need a good internet connections. So, importante nga maayo ang gadgets, no. So, I don't know for the Hurano kung paano i-work from home, ina siya, but there are other industries nga who look up to the work from home, kay siyempre, like the BPOs, hapos lalaya sa ila. Anyway, internet connections lang na ang gina-provide and laptops. Another scheme would be alternative work schemes, no? Like for example, if they used to be working in a as a cashier, for example, in a restaurant, then siguro kung mahina ang gasulod nga dine-in or ang take out, then you can transfer the cashier to another work, no? So alternative na work scheme. Another is the flexible working arrangement wherein the employer may offer, let's say, reduction of the working days, rotation of work, or flexible working alternatives such as ipa-absent sa anay, i-use up anay ang ilang leave credits so that they can earn while they are on leave, no? But those are mga examples during that time when we were still in the ECQ. So actually this adoption of the work from home, alternative work schemes, or flexible work arrangement can be adopted by the employers for as long as there is public health crisis, no, going on. So, siyempre, hindi taman kabalo kung hasta saan ang pandemic. So, gina-allow siya, no? What is only very important for the employers and the workers is they are able to discuss it first, no? If ma-present sang employer ang sitwasyon sa ilang empleyado, and for the employee also to know kung gid ang maayo, and then tagaan man chance ang employee to also share or contribute ideas man, and then in the end kung anong arrangement nyo, amo ina siya ang patihon kag sundon man sang DOLE. So there should be an agreement on the part of the employer and the workers, and there should be proper reporting, no, sa DOLE nga nag-alternative work arrangement kamo or whatever options nga puhaon. So in this case, kung halimbawa nagaubra, no, ang atong gihapon nga empleyado, or we are still, or our business is still open. So dapat may mga minimum public health standards kita nga to be complied with in the workplaces, like the face mask must be worn at all times, no? And when we say at all times, we suggest that it should be worn from the house to the workplace and the workplace back to the house. So kung pwede nga hindi nila pagkakason, ina siya na habit, no? And of course, the wearing of medical grade face mask, highly encouraged, magid na ina siya, but medyo mahal lang siya, but ang protection niya sini is 95 to 99%, no? Like ang mga N95 na, no? But mask with vents should not be used, no? So kinahanglan careful man kita if our, like yesterday when I had a face-to-face conference in the office, may isa ka worker yang ang ginagamit sila, ginatabo na yan sa likod daw cloth na nga makita ko gani ang iya nga baba. Siling ko you need to wear proper mask and face shields. Siling ko kay hindi takandi pagpasudlon, no? So importante man na, especially that your group is with the service sector, no, nga may mga food. So on the other hand, kay ginasuggest man nila nga pwede man kita gamit sang cloth mask, pwede gid siya magamit as long as worn with a filter, no, such as tissue paper or other similar materials, and must be cleaned and washed daily. So kwanda gani nga hindi gid siya siling kakas-kakason ang aton mask. Okay, next slide please. We're cloth mask, dapat may filter, no? Must be released and properly disposed of daily or after sneezing, coughing. So dapat ang employees nakabalo sini. Hands must be washed, disinfected before and after replacing the filters. And frequent touching and adjusting of face masks must be avoided unless necessary. And when we use our mask or disposable mask, it should be disposed of properly after use. Next, please. Now, this guidelines also requires the wearing of face shields. No? So it should be used nga ang face shields gali should cover the entire face, no, hindi lang goggle nga face shield, no. So it should be from top hasta dire, hindi pwede ang visor type na face shields, no. So face shields and masks should always be worn together, because if we use mask and face shield, we are protected kuno 93 to 95%, no. So mas maayo gid nga both, no, may face shields, mask. However, for may mga type of works nga hindi kinahanglan kuno ang face shields kag nagaapekto sa ila nga trabaho. If that is the case, face shields may be taken off if there is if it is interfering with work, no. And face shields may only be removed according to the demands of work. Okay. Next slide, please. So, remind ang tanan that the minimum public health standard is still physical distancing of at least 1 meter or 2 meters when possible, and it shall be observed at all times. And this must be practiced together with the wearing of masks and face shields. Next slide, please. And part also of the standards is for the workplace to have frequent disinfection, like hand washing with soap and water, or the application of alcohol-based disinfectants. It is already mandatory in all workplaces, and it is even encouraged at home, no? So we really need to remind our workers to wash hands all the time, no? Kasi simply, hindi man na, it should be already a habit under the new normal. Aside from the wearing of masks, face shields, social distancing, dapat give may frequent disinfection. No? Next slide, please. Next, please. Okay. It is also very important there should be signages all around our workplaces, no? Or mga reminders to practice proper hand washing and other hygiene behaviors. Kay mante kung gakalipat ang aton employees, so constant reminders, no, for them to be aware that they need to hand wash, they need to disinfect also their workstations before the start of the shift, during the shift, and at the end of the shift. No, importante kabalo sila kung ano ang objective or ang rationale where they are required to disinfect the surfaces, no? And also discourage sharing of personal items between employees to prevent possible transmission. So like for example, we need also to inform them, you know, you have to have your own ball pens. So you have to carry that all the time so that hindi mo pwede nga ipahulam ang ballpen mo sa iba, no? Or kung ipahulam mo, kailangan i-disinfect mo dayo ng ballpen, and so on and so forth. No? Next slide, please. For big companies or large companies with total assets, for example, above 15 million, the guideline says that employers are enjoined to provide shuttle services, no, to their employees, no. Ang shuttle services may be offered for free or for a reasonable fare, no. So but kung if we will be charging fares, then that should be with proper consultation with the employees. Next slide, please. Shuttle services, of course, while inside the shuttle, dapat may mga protocols man kita nga dapat avoid sila talking with each other and on the phone. Tapos may butangan taman ng shuttle, tas ang signages of no talking, no eating, no taking phone calls, no? And of course, they are still required to wear face shields and masks at all times and observing physical distancing and frequent sanitation and disinfection. There are shuttle or vans nga ginahire sa mga BPOs nga to ensure the compliance of this, gaupod ang gwardiya, no? So before ka magsaka sa van, gapirma ka sa logbook kung sino ka nga nagupod sina, tapos kompleto ka sa mga personal protective equipments, and of course may gaupod nga gwardiya to ensure nga gina-follow social distancing and wearing of the mask and face shields and so on and so forth. This slide naman speaks of adequate ventilation in the workplace. Like importante siguro that we have good filter, no, of our general ventilator. So sometimes i-check naman whether limpyo ang aton filter, or whether kinahanglan siya i-change, kinahanglan siya i-clean. But importante also nga we should open, no, our windows for natural air flow nga magsulod sa workplaces nila. So but in this case we have to turn off our air conditioning units. Kay there is a study also that says nga from time to time we need to open our windows para magwa kuno ang mga bacteria or virus inside the workplace. Next. So we have discussed this earlier nga dapat strictly enforce gid, no, strictly ang pag-wear sa mga PPEs inside the shuttle services, and pwede man nga ang shuttle should have also 3 inches of opening, no, while in transit, if possible lang siya. Next slide. This one is for mandatory advocacy awareness raising programs of the company or the organization also, no. Kaya we should never get tired of reminding our workers from time to time what are the things nga i-avoid naton, and then what are the things nga dapat i-comply ta on occupational safety and health, no. So this one, if we have the OSH committee, if we have the safety officer, then the one who will give orientations, perhaps facilitate the conduct of webinars, virtual lectures, and training on COVID-19 prevention and control should be the safety officers or the safety and health committee in charge, no? So maybe we should also give information to our employees on the best practices to be attended by employees and the management. Okay, next. This one, nadugang niya sa supplemental, no, guidelines like provision of the designated smoke areas, because the smoking areas can also, if they are smoking, kag bisan diin lang sila mag-smoke, it also contributes to the risk, no? So we have to make sure nga mayo clean air nga aton nga workplaces. So therefore, kung may mga employees kita nga panigarilyo nga hindi malikawan gid sa trabaho, then there should be provision of smoke areas or booths, no, for them. And in that case, employers shall require employees to strictly observe physical distancing and the applicable health protocols now. Bawal mag-istorya inside the smoking areas. Okay? And also in the guidelines, we should also help no in reducing contacts like gina-cite diri ang the most at-risk population for COVID. These are the senior citizens, the pregnant women, individuals with underlying health conditions, no, and those below 21 years old. So it is suggested that if we have employees belonging to this age group or this population, at-risk population, then it is suggested that they will continue to observe work from home arrangements, okay? But they may be required to work occasionally in the workplace, provided that a certificate of fit to work is secured from the OSH personnel or the safety officer, and must only stay in the workplace only for a specified number of hours. No, we should be limiting physical contact no inside the premises. So sila ni abing vulnerable nga mangin carrier no sa mga sakit or mahawaan man sang sakit. And of course, there is still restriction of mass gathering. This is a guidelines from the IATF, no? So only 10% of seating capacity for meeting rooms in high moderate risk areas, no? And a maximum of only 50% seating capacity for low risk areas, which means gina-avoid natin gihapon ang trainings. So kung pwede lang through Zoom or virtual, no? Or teleconference, just like we're holding right now. Next slide, please. This one naman is on the staggered meal hours. To reduce contact, no, we can adopt staggered or alternate meal schedules, no, to lessen contact among our employees. But it is also suggested that employees will be the best option always is for the employees to eat alone in the workstation, no? It is highly encouraged gid nga makaon siya sa iyang desk, no? So that means may balon siya, may utensil siya nga kaugalingon niya, so that ma-ensure ta ang compliance to physical distancing requirements. So, although if enough area, for example, for the meal areas, we can use other areas like our garage, no? Ibutangan sila tables dira sa gwa for them to eat, no? Observing no talking and social distancing. Siling nila ko, no, mealtime is always where people converge. So when there is people converging in one area, dira nagasugod, no? When they started to talk, so dira gasugod nga basi kon hindi ta mabalaan nga may virus na gali. So with this, our employees are encouraged to eat alone with packed meals. So avoid ko no ang buffet table or karinderya type na turo-turo. Okay. So or if we have canteens or dining areas, we will also put signages to comply with physical distancing and at least 1 meter, and employees shall be prohibited from talking with each other. No? Next, please. Here is the safety officer. This is in compliance with the Department Order 198 of the Occupational Safety and Health Standards, or the OSH policy, wherein there should be one safety officer for every workplace. And the safety officer refers to any employee or officer of the company trained by the DOLE and tasked by the employer to implement OSH programs. So he is not only tasked to implement OSH programs, he is also required to implement the protocols for the workplace safety and health protocols. So the safety officer actually has a big role or responsibility of looking the areas, the workplace, tapos libuto niya na, for example, base kung constantly dapat i-remind niya ang employees kung wala ga-wear sang mask, face shields, or social distancing. So he is all responsible of looking at areas that determine how many workers need to stay in the locker room, in the toilets or canteen, and etc. etc. Okay, so for contact tracing, na-intra sa supplemental guidelines in the management of asymptomatic and symptomatic individuals at the workplace. So contact tracing kuno among the workforce. Bale, employers shall conduct contact tracing within their workplace to identify close contacts. So the employers who have CCTV may be used to determine close contacts. Or some of the employers have logbooks or online or digital nga mga attendance or logbooks. So that is very important. So that mabalaan ta kung sino ang may symptoms sa COVID. Employers also shall ensure that close contacts of employees whose RT-PCR test confirmed positive should undergo a 14-day quarantine period. So during the 14-day quarantine period, close contacts shall be required to regularly report to their employer any development including new symptoms. Kag ang symptomatic employee should update their employer regarding their COVID-19 test results from a nationally accredited testing facilities. So amo na siya na importante nga we have to help the government or help in the contact tracing of our workforce. Next is contact tracing within the workforce. Ang mga close contacts who remain asymptomatic for 14 days may return to work without the need for a test. So for example, ang aton empleyado, nag-positive siya to COVID, so mandatory ang 14 days quarantine. Then after that, no need na for another swab test kung wala man siya isang symptom or asymptomatic man siya sa 14 days. So pwede na ang employee makabalik sa obra. But during the 14-day quarantine period, ang employer give works or assignment or task for work from home. So on COVID-19 testing, all employees in the hospitality and tourism sectors, like in Boracay, nag-declare sa DOT, so dapat may COVID-19 testing sila once every 4 weeks. This is mandatory based on the DOH Department Memorandum Guidelines nila. So may mga next few slides kita nag-explain man kung sino ang dapat na mag-COVID testing, like employees in the manufacturing companies and public service providers in economic zones may be tested once every quarter. Sa frontline economic priority workers like in the food retail or education, sa food retail, waiters, waitresses, bar attendants, baristas, chefs and cooks, restaurant managers, and supervisors, dapat may ara man siya sa COVID-19 testing, Once nga face-to-face classes resumes naman niya sa mga school, dapat teachers at all levels dapat may ara man sa COVID-19 testing. So these are supplemental guidelines na to be followed. For frontline and economic priority workers, kinanlan ang COVID-19 testing for bank tellers, cashiers, stocklers, retail salespersons, and market vendors. Next is for services, also like the hairdressers, the parking lot attendants, security guards, messengers, clergy, no, ushers. So importante gihapon ang COVID-19 testing. Next. So employers shall establish OS committees, no, and or appoint safety officers, or sometimes we call them the COVID officers, no, in the workplace, who will oversee enforcement and monitoring of the minimum public health standards for COVID-19 prevention in the workplace. And these guidelines nga gina-explain natin. So for 2 or more private establishments housed under the same building, one joint occupational safety and health committee shall also be established. Next slide. Here is on the leave of absences and entitlements. Okay. So the use of leaves of absences and entitlements shall be governed by the pertinent rules and regulations promulgated by the DOLE. So kung gahatag kita sang 5-day service incentive leave in 1 year, that would also be followed. But if we have employees nga nag-quarantine, for example, 14 days, tapos why na siya sang leave credits, kay na-consume na niya, no? Kaya 6 months na kita ara sa pandemic. So, ang DOLE is, of course, knocking that panuktok din kami sa compassionate heart of the employers to give leave credits, no, para sa employees nga ma-sustain niya, no, nga maka-quarantine siya for 14 days with pay. But in the event nga do budlaygid siya, I have talked with SSS. So in the case of leave of absence nga inabalang chargeable tani sa ilang leave credits pero na-consume na sa employer, the employer may file sick leave with SSS. Pwede ko na. Then hospitalization benefits or Philhealth members shall be based on Philhealth rules and regulations, no? And SSS benefits shall be according to the policies of the SSS also. Okay? So employers are highly encouraged to provide sick leave benefits, medical insurance coverage, including supplemental pay allowance for employees who are tested positive for COVID, no, based on the RT-PCR, and or close contacts ng employees who have undergone a 14-day quarantine. Okay. So those are mga salient features, no, on our supplemental guidelines issued by DTI and DOLE. And just to inform you that DOLE and DTI are going around the city to check on the compliance of this joint memo circular. But since Bacolod is in the MECQ, so ang DOLE is trying our best na ma-monitor kami even virtual, no? We tested nga daw kung ang employer may ara man lang sang connection, pwede kami maka-monitor through online. So that would be all for the updates on the issuances regarding workplace prevention and control of COVID-19. So thank you.